Okay, well, I guess we'll go ahead and get started. Maybe people will trickle in as we kind of move along. So part of it is we try to have a general meeting at least once a quarter. And especially at the beginning of the year, we try to have one as the proposals open up for conference in the coming year to see if there's other opportunities for collaboration, things of that nature. So the meeting today is kind of twofold. So we'll talk a little bit about potential proposal ideas or collaboration ideas. I'll also review some of the feedback that we got in terms of some of the higher rated presentations and ELOs that we had at the conference. And then I also wanted to get some insight from the larger membership because we didn't have the kind of usual format for our general in-person meeting at the conference because a lot of the leadership was out either sick like myself or expanding their family. So we had some people, the leadership team, invite new individuals into their families, little ones. So also wanting to hear from you all in terms of initiative, webinars, topics that you want to see from the SIG in the coming year. So I'm serving as chair this year for the SIG. And then Missy, I didn't know if you wanted to introduce yourself because you have a leadership role on the leadership committee for the SIG this year as well.
Yeah, I'm the early career professional this year, and I am a doc student at TWU. I'm also I guess, a marriage and family therapist associate at this time, and my research areas are medical family therapy, neurodivergent relationships, and just chronic illness, that kind of thing. So I'm excited to be here. I'm excited to work with other associates, medical family therapists, and early career professionals. So,
Right. Thanks so much. Let's see. So I guess we'll go ahead and get started. I do have just one announcement. So within our newsletter from time to time, we've put in those 55-word stories where we give an opportunity for professionals or students working in integrated healthcare environments to kind of share their experience. And then we kind of put those within our newsletter so we can see some of the exciting experiences people are having while they're working in this setting. So the first time we put out the call for 55-word stories, we got so many back that for the last, I think, 8 newsletters, we haven't needed any stories. But our pool is starting to run a little low. So I'm going to put my email in the chat. If you wanted to pass it along to any of your colleagues or you had a 55-word story that you wanted to share from your own experience, feel free to shoot me an email. I also am going to make a larger announcement to the listserv as well to see if we can capture some other members of the SIG that might want to contribute to that as well. But feel free to share your stories. And we have another newsletter that will be coming out in the summer where hopefully we get to, as we usually do, kind of announce those new fellows in collaboration with the consortium who might be joining the various programs, as well as giving some other updates that are related to the SIG and upcoming webinars, things of that nature. And then the other thing that I wanted to say, I'm so happy you're on the call, Lisa, and I was hoping Randall would be on the call as well because I was unable to be at conference this past year, and you all just really stepped up and helped us to get the dinner organized and have someone to represent, at the general meeting time slot. So we really appreciate that. It was like a lot of unexpected things happened all at one time. So really appreciate your willingness to kind of step up and engage in that way.
Not a problem. It was, and this is what happens, right? And any one of us who work in integrated care know that things change on a dime most of the time. So that wasn't a problem. I'm
Yeah.
glad we were able to make it work.
Yeah, yeah. So yeah, I just wanted to make sure that we kind of acknowledge you in that and kind of express our thanks. Now, it's my hope, as I was telling David, that we won't have to do that this year. That we'll be at conference, especially since it's a little closer. I'm in Texas, so it's only about a 4-hour drive away or so. But want to express that nonetheless. Okay, so I guess we can just jump in terms of like membership feedback. This is kind of just an open group discussion. This past year, we did a lot of collaboration. So we had a collaborative webinar with the FHSIG where we talked about like play therapy interventions. We did some cross collaboration with the MedFT Consortium and the AAMFT 10, kind of talking about integrating a MedFT focus within MFT programs. And we're just hoping to keep that momentum in terms of cross collaboration, maybe looking to have more interdisciplinary presenters and presentations as we move forward. But as we're planning out our year and the webinars that we wanted to kind of cover, we wanted to hear from you in terms of, I don't know, it just seems like integrated care, it's an ever evolving landscape. I was reading an article today where it was talking about more and more providers are moving to telehealth. So then what does collaboration look like in an integrated space when people are kind of working in their silos and doing virtual appointments, and how do we maintain that? So and then we have new information coming as Medicare becomes a thing here in the United States and more providers have access to that, particularly MFTs. So just wanting to hear from you all. Do you have ideas about maybe the trajectory of the field and how we might be able to contribute to providing topics on particular issues that will be important to just making sure we keep a family-centered focus as the integrated health field expands?
Brittany, remind me, when was the last time? Sorry,
Oh,
I
you're
have
good.
not attended a lot of things.
Mm-hmm.
My time conflicts a lot with when webinars are held and things like that. When was the last time we did something on ethics, just in general, like
Oh,
ethical principles and management of families and integrated care? And I'm mentioning it because of course I work with a lot of psychologists within our
mhm.
healthcare system, and so they will send things through on our listserv about something that I think their division is working on related to that.
Yeah,
And I thought, I can't recall the last, I think we've done some maybe related to specific groups, but I
yeah.
can't recall the last time we did something just in general. What are
Mhm.
ethical considerations for family therapists working in healthcare settings, and how do we provide family centric care in an ethical way, regardless of what your background is? Knowing that there are very different laws
Mm,
related to privacy and related to confidentiality across different systems that you're working in, right? I mean,
mhm,
we have basic little things that pop up in our clinic. They saw a patient in the hospital, the family member was with them in the hospital, family member calls the clinic then to see how the patient is doing, and now all
mm,
of a sudden we can't give them that information because they never signed a release form,
mhm,
yet they were
mhm.
there for the entire hospitalization. It's those little, so I'd be curious if
Nuances.
we could create when was the last time we did something related to ethics, ethical scenarios, and if we should create something again.
Yeah, and a 100% fair point. I was looking here at our webinar list, and I think it goes back just over the past 2 years, kind of what you can see most relevant on the website. And I don't see any webinars that the SIG has hosted in terms of ethical practice within our field. So
Mhm.
that might be a good webinar to introduce, especially where you're thinking also, Lisa, one thing that comes to mind in terms of ethics, like the ethical guidelines for a behavioral health provider looks a lot different than that of a physician, but we're kind of
I know.
navigating the
Yeah.
same space. So do you see this being more of an interdisciplinary talk, or what are your thoughts?
I mean, that was kind of where I went initially, but
Mhm,
I also see no physicians on our call today too. And that's just been a struggle that I think CFHA has had on and off throughout the years, right?
mm,
That we still tend to pull hard from behavioral health, and a little bit less, and much less so in some ways,
mhm,
from our nursing and, physician groups. One thing I suppose you could look at in helping us determine that is what the membership for the Families and Health SIG looks like right now.
mm, mhm,
Who's signed up to get, newsletters and things like that. What's our primary target audience to begin with?
Mhm.
I think and then we could work it from there, right? I think it would be important to at least touch on ethical considerations for other groups, right? For other care providers.
Mhm.
But how much of that we bring to the forefront could look different.
Yeah, depending on membership.
I think I'd look at membership, to be honest, to give us a start, because I don't know um, how many people outside of our members actually attend
Mhm.
webinars, right? It's usually our own people. So
Yeah.
it would be good to know generally what our target audience looks like for
Yeah,
other
I think
things.
within the past year, and Hannah, you can correct me if I'm wrong, but we used to have our listserv go out particularly to our membership, but now our listserv is geared towards all CFHA members. So we have this potential to capture a larger body of interdisciplinary professionals, but I think who ends up showing up to our meetings are us, right? And so I think that's one thing that we always wrestle with, is how do we pull other collaborators into the fold?
Yeah, that's definitely true. The listserv goes out to all members now, or at least all members who have wanted to stay on the listserv. Just a little like coming down the pipeline heads up, we are in the process of transitioning to Salesforce for our like database. And with that, that's going to allow us to do a lot more sort of like tagging of members, like keeping track of what meetings they attend and then using that information to target marketing of future events to people who will be interested. So we're hoping that with that we'll be better able to send like targeted messages for things like FHSIG meetings or whatever it is, to like, oh, these people attended this community conversation on a family related topic, so let's send them the info for the upcoming Families and Health SIG meeting, that kind of thing. So that's still a few months down the road before we're even on the system, but that's the direction we're kind of moving.
Okay, that's good to know. So I think, as we're planning this out, just looking at potential panelists or um, individuals that might lead a webinar on this particular topic, just keeping in mind if we wanted to just make sure we add a bit of a segment about other disciplines and how behavioral health might interface, those ethical practices might interface with that practice. I did want to say hi to Angela. So Angela's our chair, our incoming chair for 2025. So I know, Angela, if you wanted to introduce yourself real quick before we move on.
Yeah, hey guys, sorry I'm late. I had a dentist appointment run long. But I'm Angela Hefner. I'm Director of Behavioral Health at UT Southwestern Medical Center in Dallas, and happy to join the leadership team.
Great. Okay, Lisa, one additional thing before we move on, or just for the larger group, any individuals that might be great to reach out to in terms of maybe their writing or their practice kind of focuses on ethics within this sector of the field. That always becomes a little hard on who's doing this work.
I didn't think of anybody off the top of my head. I'd have to think on it a bit, to be
Mm.
honest with you, Brittany.
Okay.
But it might also depend on, again, how we want to run this, right? What if are we teaching or are we having a conversation? Is this going to be more of an open forum? Anybody who attends, we're just going to have ethical scenarios and how would you manage this? Would it be a panel discussion, for example, where, gosh, just about any one of us could probably attend a panel if somebody created ethical scenarios, like what do you take into consideration when you're trying to manage these things versus having a content expert?
Right. Yeah. I think as we're planning out, maybe trying to find that balance in between the two, because I think even in looking at some of the feedback from some of the presentations at CFHA, the past conference, it's okay, what does then clinical application look like of some of these beautiful tenets that have been presented? So something to keep in mind. Okay, great. Any other topics that would be important for us to cover this year, in y'all's opinion?
I don't know if this is something we want to handle or not, but a colleague of mine just texted me as we were talking if I was going to attend something that he's giving, a talk that he's giving to our residents, but on ageism.
Mm,
And I think that it's a very prevalent topic right now, and one that doesn't really get a lot of discussion and press. And I think it would be important for us, as you know, there's so much family, right, that gets involved in care of the elderly.
right.
But how are we also managing discrimination against that group,
Mhm.
and their ability to navigate the system as it relates to that, and how family becomes involved, or different, family advocacy around ageism, right? Anyway, I'd be happy to talk to my colleague, if he wanted to do that, or at least, present I guess he's giving our grand rounds in June on it. So
Okay.
I could attend the grand rounds and see kind of how that goes, how it might fit with the things that we do. He presented with me at CFHA this year too.
Mhm.
He's a geriatrician. So
Okay. That sounds good.
anyway,
Yeah, I think, part of that is how do we make sure that patient maintains their voice in the midst of other family members that want to have a say about their care or might see them as incapable of making informed
Mhm.
decisions about their health. Yeah.
Yeah. And then what is available to them for healthcare, right? I mean,
Hmm.
sometimes there's family value discussions that need to be had about how we are going to move forward with a diagnosis, right, with an elderly patient. But um, at the same time, there's also lots of discussion where sometimes providers are less willing to suggest aggressive forms of treatment for somebody,
Hmm.
even the age of 70 and above. Well, depending on your genes and your health, you could be doing pretty darn well at 70. Like,
Hmm. Hmm.
and to not even have the information be available, and then is a little disconcerting. And then how can we help families, in our role, how do we help families advocate,
Hmm.
even if they don't know what the treatment options are, how can we have them advocate for a clearer conversation even? So
Hmm.
just
Great, great ideas.
Another thing that seems to be coming up on the listserv is the whole issue of treating trauma or not
Hmm. Hmm.
primary
yes,
care. That
yes.
seems to me, I caught some stuff just before I jumped on the call, and it seems to me quite interesting. I remember talking with Angela a while ago because she was doing some EMDR training. I've done EMDR training. I use EMDR, and I just think it's an interesting conversation in there. With both, I mean, trauma within the context of the family. So my EMDR supervisor is also a family therapist,
Hmm.
which makes for some interesting conversation. So I just wonder whether that was also, a kind of a potential topic
Yeah.
somewhere.
Most certainly, especially when you're in that primary care setting and you're limited to that 30-minute appointment. I know sometimes you're only seeing that patient
Yeah,
once or twice a
yeah,
month, right?
yeah,
How do you operate
yeah,
from
yeah,
a
exactly.
trauma-informed lens, right?
Yeah,
And what are best practices? I think part of that conversation was, I'm EMDR trained, but
yeah,
I've opted out of doing
yeah,
EMDR and, those brief interactions with clients. So how do I navigate their trauma,
yeah, yeah.
Mhm.
Yeah, I saw some of that, Brittany. I was thinking the same. I was thinking, yeah, how do you if you're on? Yeah.
Yeah, I think that's a great topic. And then one other thing that we've been toying a bit with in our leadership meetings is ways to capture new and incoming. And I think this is a conversation we're having across the board. I know, Lisa, this comes up in the consortium also. How do you capture early career professionals uh, to the organization and kind of bring them into the fold? I've been talking because some of the other SIGs, PCBH is one that comes to mind. They have a peer mentor program where kind of an earlier career professional is either like matched, or they hold these events that are specifically targeted towards early career professionals, where they can ask questions to individuals that have been in the field a little bit more about establishing a career. I didn't know if you all had any thoughts about what those efforts might look like specifically as it relates to the SIG. You know, I don't know if we have the, and this is something that I probably could ask on the listserv, or we could send out a survey, what capacity we would actually have for one-on-one mentorship, which I know it might be something that students are, our early career professionals are interested in, but everybody's so busy. Or should we be trying to look at targeting maybe a larger audience and inviting particular programs that house interns and associates that kind of work in this sector of the field, and targeting some webinars specifically for them this year?
We do small group mentorship,
Yeah,
you know,
I mean,
professional with like 3, maybe 4 at most. Right, because I think it depends on how you want to attack it. Do you want to have a more of a one-on-one experience versus like
mhm,
my concern, or at least question maybe, is how would we make sure that if we did it in a webinar based way, that we're really hitting on the correct topics?
mhm,
As we're trying to gather more people in and we're working on workforce development,
mhm,
we're probably trying to pull them from graduate school programs, and everyone knows you're not exactly not busy as a graduate
mhm,
student.
mhm, mhm,
And I don't know how much time there is to think and reflect. Sometimes I'm like, yeah, I definitely would need that in this context, versus on the fly help as things arise, maybe in an internship site that you're involved in, or something comes up in a practicum, right? Where
mhm,
now we kind of want to talk about it. I wonder if it would be easier for us to facilitate smaller groups that could meet as they are able, right?
mhm,
Kind of in an ad
mhm,
hoc way. And whoever can make it, right?
mhm,
This is the day time that you're going to have your supervisor, not super, your mentor available. They can check in ahead of the mentor can check in ahead of time. You know, is everybody going to be able to make it? If not, we'll cancel the meeting, you know,
mhm.
unless we want to try to hold people to something a little bit more formal. I just know that we get pulled in lots of different directions that can make that a little challenging.
Yeah, I was wondering, Lisa,
But
as you were speaking, like, could this be something that we do in collaboration? I know we would have to talk to the consortium, of course,
that's where I
as
was
we're,
thinking, yeah, if we wanted
yeah,
to work in
like a cross
collaboration with that
collaboration.
group. Yep, yep,
Mhm,
where we can just touch on a few more, um, just a few more professionals who might be interested and available in that way.
right. I wonder if we,
And
oh, sorry, go ahead.
no, no, go ahead.
Oh, I was just saying, I wonder we might kind of panel our membership to see if anyone might be interested. And then as we are developing the network through the student consortium group, see if we can kind of
Yeah.
make some connections in that way.
Mhm, mhm.
Yeah. I don't, Missy and Frederick, I don't want to put you on the spot, but you're students, so I'm kind of speaking to your demographic. Do ideas come to mind in terms of something that you might be looking for in terms of mentorship?
I like the idea of more of a group-based mentorship, just because when I think about individual, it may seem more like a supervision, I guess, or
Mhm,
I just prefer myself prefer bigger groups, because I think we all learn from one another, and there's so
mhm,
many different perspectives that it, for me at least, when I hear, multiple people, I can kind of then conceptualize like what I would want to do in a situation, or what that looks like, rather than just hearing from one person. Not that that one person isn't valuable, but
mhm,
it just gives me different perspectives on different situations. But
mhm,
I would like if we had something like Slack or something, have a group like that. And then if there's individual questions during the day while they're in internship or something, they can send it to the group and whoever can respond could then respond to that, you know, during the week or something. But I like the group idea.
Yeah, I concur with Misty. You know, it's definitely two or more brains work better than just one, you know, and to have that ease of access, like in Slack or some other medium, WhatsApp or any other kind of app that we can have this continued kind of mentorship throughout, like in the moment, in vivo almost, if possible, I think would be beneficial in that sense. But yeah.
Yeah. I think as we kind of continue to have these conversations and reach out to potential mentors, kind of seeing what their capacity is and making sure that, you know, what the students are asking for or these early career professionals are asking for, and then what they feel like they have the capacity to facilitate, we're able to kind of have those conversations and see where we might be able to meet in the middle. Okay, but it's nice to hear that maybe this might be something that would be beneficial for us to kind of sit on a little bit and begin to develop a little bit more within the SIG. Okay. Other thoughts or ideas related to topics or webinars or potential panels before we move on to conference feedback and proposals?
One of the other things I was thinking about for topics, either for conference or webinar, is connecting specifically family support to chronic disease outcomes and management. And so helping our teams understand, and maybe you guys already talked about this in the first few minutes, but understand how can we talk with our patients about the support they're receiving from their family and what that looks like, and facilitate better support from those family members to support their chronic disease management and outcomes.
Are you, what comes to mind as you're saying that is because most patients may come to their appointments by themselves, right? But we're not really seeing kind of the larger influence that the family system is having on their care management or specific outcomes or metrics that we see during their appointments.
Right. And like thinking about diabetes in particular, there's so many elements of managing diabetes that go beyond just like, here's your prescription. And there's, you know, medication management gets really complex, dietary changes, lifestyle changes to physical activity. Families have to reorient their whole meal plans and diets and cultural factors that come in. So it's bigger than just the patient. And I think that would extend to other things like hypertension as well. So I think there's probably more that we can be doing from a family systems lens in primary care for that, from that perspective.
And of course, interdisciplinary collaboration again comes to mind when I think about this topic, right? How physicians having these conversations, and then in what role does the behavioral health oriented provider maybe facilitate greater dialogue between patient, physician, and the larger context of the family. Okay. Do you have ideas in mind, Angela, in terms of potential discussion leaders or webinar leaders or collaborators for that particular topic?
Not off the top of my head, but I could do some more thinking about it.
Okay, sounds good. All right, so we're at the 35-minute mark, so I wanted to make sure that we could jump into some of the conference conversation here. And let me share the screen just so I can kind of keep notes as we go. Or Misty, I'll share this with you really quickly so you can type as we're chatting. Okay. Let's see. So we were able to get feedback from a significant number of conference presentations. Are you guys able to see the Excel sheet? I have so many windows open on my computer. Okay, perfect. And so we just wanted to just make sure that I was able to give people feedback in terms of what people liked and maybe what they want to see a little bit more of. So just starting off with the family interview that was facilitated during this past conference with John Fromm and that whole group. That was something that we had been talking about for, I think, the last year or two about bringing back. And this past year, we were actually able to facilitate that in-person family interview. People really enjoyed this presentation, and some questions came up around the possibility of recording future family interviews. It seems like something that people want to see more of from us, just how to facilitate those more family-centered interactions and conversations as it relates to chronic illness. But the question came up around recording and publishing of those trainings. Of course, there's kind of additional levels of consent, but people wanting to have more up-to-date videos around how we might facilitate some of these patient interactions. I know there was that push or collaboration we did with the WMFT-10, where there were some scenarios that people put forth and there were some recordings that were published online, but I don't recall if any of them were like couple interactions, much like we had the family interview. So I know part of how we were able to facilitate the family interview last year is that there was a practitioner that made a referral, and that couple was in Arizona and willing to kind of engage in a discussion. But I guess wanted to just get your thoughts. Is something that we might want to consider keeping as a standard as we move throughout conferences? Should we try to do it again for this year? I know this is a broader conversation. We would have to find a couple willing to participate and people that are willing to engage in a panel, but just your overall thoughts. I unfortunately didn't have the opportunity to attend. I didn't know if either of you, anyone on the call, had the opportunity to attend the interview and what their experience was like of it.
I always feel like these are good ones, especially for students to see, or early career professionals, right? Or people who are just a little less certain about how to integrate families into care. They've done it a number of times throughout the years. This was actually the first time I'd been able to attend one. And even I still found it enjoyable and lovely to be able to think about things maybe in a perspective that I haven't taken in a while for care or things like that. So yes, I would be in favor of trying to
do that.
Do it again if we can. Yeah.
Okay. I might reach out to see, if John is planning to go to conference again and how we might wrap around some individuals. I don't know who's taking kind of point for the conference. I know last year was in Arizona, so Ruth became like this good medium between like connecting us to practitioners on the ground. But I don't know. Hannah, do you have any ideas on like who's taking point for conference this year?
The co-chairs of the San Antonio Planning Committee are Clarissa Aguilar, Yahaira Johnson Esparza, and Maria Montanez, I think. I'm not super familiar with what their professional roles are, so I don't know, how well connected that would be for you, but those are the three to reach out to if you would like to.
Okay, we might follow up with them and see if there's some opportunities to kind of get a similar family interview going for the upcoming year, and see if John or anyone else, would anyone on the call be interested in facilitating a family interview? Okay, it's okay. I know there's a lot going on. But we'll kind of follow up. The other piece of feedback that we received in terms of the conference, there was a presentation on clinical supervision. And it ended up just being kind of a general presentation at conference, but a lot of the feedback within this specific presentation, a lot of people wanted a more expanded conversation. Yeah, a lot of the feedback kind of bridged into, could this be an ELO even potentially, where there's more time to have clinical application, vignettes, things of that nature, as it relates to clinical supervision in primary care. And so I was maybe hoping to reach out to those collaborators to see even if we might facilitate a webinar like this via CFHA, or kind of would they be interested with some other collaborators to kind of expand their presentation to more of an ELO. But that was another presentation that got a lot of feedback where people were just kind of wanting more. And I think just conversations that we've had in the past year, especially as people are renewing even their double MFT approved supervision, it's just, there's not many conversations about what supervision looks like in an integrated care context. And so, how might we contribute to expanding on that conversation and giving people more insights there. Yeah, I don't know if anybody had any thoughts about this or interest in this particular area as well.
Did the feedback mention any specific topics for continued discussion?
That is a good question. I am going to, let me try and pull it up right now to see.
I also didn't get to attend CFHA last year, so I missed these.
Oh yeah, no problem.
So I don't have context for what the conversation was and how it might be expanded.
Yes, so, oh, sorry, go ahead, Angela.
Who's talking?
Oh, sorry, Lisa, I don't know.
That's okay. I was just I did attend this one. That's all. Response to Angela's question. I'm trying to remember all the specifics. Yeah, there were a lot of really, really good pieces, but it was higher level. Like these are models of how you would do clinical supervision. Here are things that you need to take into consideration when doing clinical supervision. And I think it was just an hour and a half long presentation. And yeah, I think you could take what they did and just, give more examples. If we're going to be involved, make this, because Deepu was involved in this one too, how we can make this a bit more family friendly, family therapist centric friendly, right? Yep. They talked about different like assessment tools that they used to help learners determine kind of where they were at and their ability to provide integrated care. There were a number of different tools and acronyms, if I'm remembering correctly. Sorry, it's I remember really liking it. How does that sound? And yes, leaving with that feeling that there should be more examples about how we do this, or we could even probably give a full one ourselves, just focused on supervision in like family-centered care supervision, whether we do that through CFHA or like the conference versus we do that as a webinar or something like that.
Yeah. The most of the feedback as I'm reading it here is very much in line with what you're saying, Lisa. And then the only other thing that stands out is again that cross discipline. So being an MFT in that setting and having supervision versus being a licensed clinical social worker or licensed mental health counselor. I think people were maybe looking for some specific examples in that way, but I think to expand specifically as it relates to our SIG, having more family-centered conversations around supervision and how do you promote that in the care setting would be something I think that this conversation would benefit from, either through ELO or just another webinar topic. I know Max has done some writing on this, and so is Jack. I think they're giving a talk on this topic at the 10 in a couple of weeks, but I don't know, does anybody have interest in this particular area at all?
Yeah, I've got a lot of interest in it. I obviously provide supervision here, but I work with PCP, and so we have got a kind of tag team type supervision that we work, which actually works really well, I think. And I think it's a slightly idiosyncratic model, but
Yeah.
actually it really works. And she has got a real passion for family work and that kind of stuff. So I think it's just been an interesting way of working. And I've been doing some kind of looking at it, trying to get a bit of data on it as well. So I'm actually really interested. I think it's a really interesting topic. Yeah.
Oh,
So
great.
that's
I am too.
I was gonna say I put your name down as a
yeah,
collaborator.
that's fine. I'm cool with that. Yeah, I'm really cool with that.
Okay.
Yeah.
Okay. Great.
Yeah, I would get rid of the C. It's just Zach.
Oh, sorry. So sorry.
No, it's okay. It's Czech, I believe, is the origin of
Oh,
that.
okay.
So
I feel so bad now. I feel like on so many emails I've been like CK on everything.
I don't know if I've ever noticed that.
Noticed.
No, but similar to David, we've got, I mean, although it's not like formal supervision, I work very closely with our social work team here, and they're regularly coming to me for assistance with things. I have provided supervision to the postdoctoral psychology fellows that we have here as well. So we've done a lot of cross-disciplinary. I've actually provided supervision the least to our because our pre-doc internship is still relatively new. I've probably done the least amount of MFT focused supervision, to be honest with you, which sounds silly.
I know that feeling.
Oh, that's funny.
I have a nurse I work very closely with. Yeah. So
yeah. This is something that interests me as well. Just kind of some of the supervision we do here with the interns from, oddly enough, our interns are at UT Southwest, where Angela provides supervision also. So but it comes up as well, you know, how do I maintain a family-centered orientation in those brief interactions with patients or them in other settings as well. So I'm gonna put my name down on the list because it's something I'm interested in. And then okay, great. I think that would be a great webinar. You know, I don't know if I guess we can have a larger conversation about it. We can kind of email one another and see if we want to shoot for an ELO or just kind of a general conference webinar. Hannah, I did have one question. I know that it was mentioned that the proposals would open up today. I hadn't necessarily seen that just yet. Is it still opening today or is it planned for later?
I think that it did open today.
Oh, okay.
But I actually haven't seen anything about it. I think that Jackie's out today. She's typically the CFHA person that will attend these FHSIG meetings, and she's out. But I think she had everything set up beforehand. I'll have to double check on that. It's possible. Liana's a little bit she normally sends out the newsletter on Tuesdays, and I think it's coming out today this week. So maybe it'll be like announced in that. But I'll check in with them and double check, and it should definitely be open by next week, if not today.
Okay. All right.
there's nothing on the website yet that I'm able to see.
Yeah, I didn't see anything yet. Okay. And then lastly, before we kind of introduce other topics, the other one that got a pretty big hit is the sustaining and cultivating a career in integrated care. Just a lot of the participants really enjoyed this conversation and wanted to just kind of have a little bit more information about what the sustainability piece looks like, or how do you kind of fully establish yourself in a career in this field. And I know that's such a broad topic. I mean, because there's so many avenues. You can work in academia, you can work strictly in primary care. I know people go into consulting, and so this is a very large conversation. I think as it relates to some of the work that we're trying to accomplish, a panel comes to mind where we have individuals that work from within these various disciplines or sectors of our field. We can do more of a Q&A and a broader discussion. I don't know if that fits for others as you think about this topic, or do other things come to mind?
I think that sounds like an interesting idea, and I could see a lot of people being interested in it.
Mm-hmm.
Because I think a lot of us end up in one piece of this field and we don't necessarily know about the other options.
Mm-hmm. Mm-hmm. Yeah. I know like Ruth has done some consulting or has thought about getting into consulting. I mean, I think there are a number of individuals, like Stephanie Trudeau, for example, she works strictly in research, so there might be some individuals that we can reach out to see if they might be interested in facilitating some sort of like panel discussion over the next year, or maybe even into next year. Oh, and then I saw your note about Kathy as well, that does some consulting work. Okay.
You know what I'd recommend, Brittany? I would actually reach out to Ruth and see who all the speakers were for the speed mentoring luncheon that we did, because a number of those were meant to be people who are in different areas of integrated care. So some of it was academics, as in like, here are programs that you could attend, but others there was consulting, there was primary care, healthcare that is not academic centric. There was academic medicine. There were a lot of different places that you could go in there. And I wonder if that would be a good list that we could start from.
Okay. Yeah, that's a great idea. Okay, I'll reach out to Ruth and see if we can maybe get some collaborators and introduce this as an idea, either a panel or some sort of webinar, or I mean, it could be a workshop or a presentation at a conference. I mean, it just depends on where they want to go with it, but we'll definitely present the idea. Okay. Any other possible proposal topics as we reach the final few minutes of the conversation that come to mind for you all as we move into proposal writing, the proposal writing season? It's upon us. Great. I would like to encourage, if other potential topics arise, that you kind of reach out to your fellow colleague and see if there might be some opportunities for collaboration. I know, Lisa, I was supposed to be on it, but I got sick. The ELO that you all did, were there ideas about expanding that? And it got really great feedback as I was going through the reviews.
Yeah, I don't. There wasn't any further discussion, at least on our end, of if we wanted to do something additional with that. Yes, we did get some pretty great reviews, but I think there were like 12, maybe 10 people total that attended. So there weren't as many attendees. I think the one thing I just have been thinking about here is, we're talking about trying to come up with other topics, is just the importance of cross-discipline collaboration, right? I'm constantly at battle with we need to have things that are clearly family centric within this organization, because there is still an F in the name of CFHA, right? Like, it says family, but also respecting and seeing that it has become very PCBH focused, with more psychology PCBH, if that makes sense. And so, where do we get more traction, right? How do we balance having topics that are very clearly family focused, but
Mhm.
also just integrating ourselves within the rest of the system. So for like this clinical supervision one, right?
Mhm.
So we're going to talk about clinical supervision, but we're also going to have this lens to it. But that might be an interesting piece of just another, you know, PCBH. What does it mean to be family centered in PCBH? Right? Like
Yeah.
there are, it's not, in some ways, it's not necessarily difficult to do some of the things that we're talking
Right.
about. There's higher order things that absolutely, you know, we as family focused and family trained practitioners probably have a better idea of how to do. But at the same time, yeah.
Yeah.
It almost makes me wonder if it would be helpful to comb through the larger list of presentations at last year's
Mm.
conference, because there's, I think Lisa, you're absolutely right, that there's probably loads of those that get a high attendance, but the family lens is missing, and it would be easy potentially for our group to replicate some of those things, but add that family piece back into the conversation.
Yeah. That's a great idea. And I can reach out to Jackie to see if we can get a larger list of those presentations and see. Also, what comes to mind, which I mean, I haven't been a part of the SIG for that many years, but it also makes me wonder, have we done any PCBH, Families and Health SIG, like cross collaboration for webinars at all to kind of broach that topic of what does it look like to be family centered in a primary care behavioral health environment, or to work in collaboration with those providers, that operate from that perspective. But I would have to do a little bit more combing to see if we've done that in the past, or would there be some opportunities for collaboration in that way in the future.
And can we really work with the PCBH group, right? Can we sort of like jump in on their, now I'm just
Yeah.
targeting them. We have lots of other groups, right? Medically
Mhm.
unexplained symptoms also feels like a great place where we could get some
Yeah.
traction. But
Yeah.
do we co-sponsor things, right? Do we just sort of insert ourselves as speakers in their pre-existing topics? Right? It's
Yeah.
always this dance of, hey, we're here and we're important. But also so much navigating. Anyway.
It is. Yeah. Yeah, for sure.
I like that idea of jumping in on their talks, Lisa. Kind of just as they're launching something and see it at the conference, we kind of nip in and deliver a family focused perspective on it. Slightly anarchically,
Yeah.
Well, I thought about like the presentation that we gave, like my specific portion of it was just talking about what are ways to include family in the room if they're not in the room, and how do you include families in the room when they are in the room. And because we weren't sure who our audience was going to be, some of it was a bit higher level, but some of it was just very basic things. How do you ask if someone's not in, if a family member is not in the room, how do you ask the patient questions that makes that a more family centric thing? And that is not, it just requires a little bit of a systems lens to do some of those things.
But not necessarily always intuitive, like an intuitive.
Correct. Right. If you don't have the training or the background, you're probably not going to ask the question.
Right.
But they wouldn't be difficult questions to answer once you've got some examples of how you could do that.
Most certainly.
I'm gonna have to jump off. I'm really sorry. So I've got.
Oh no, you're good.
It's been brilliant. It's really good, and I'm looking forward to doing stuff. It's good.
Great, yeah. I'll send some of these notes out to the larger group, and then hopefully we can be in contact about the supervision conversation. There'll be some correspondence. We do have a webinar planned for April, so you'll get some information regarding that. I think we're going to cover weight loss stigma. So it'll be an interesting topic. So, all righty. Thank you so much for joining us, everybody. And it's good to see everyone. We'll talk soon.
See ya. Bye-bye.
Thanks, Brittany. See everyone.